Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. I am Dr. Mudassir Shahbaz, Associate Professor in Anatomy at Sahara Medical College, Narawal. And today we are going to discuss about the anterior compartment of the thigh, and we will discuss during our discussion the muscles, how they are lying, the nerves, the vessels, and how they function. Before starting our discussion, I would like to discuss 1 to 2 points regarding the learning of the anatomy. You know very well that anatomy is said to be more of a seeing and feeling than the reading. So the very first advice for the students, that while you are learning about the anatomy, you are reading any book to understand the anatomy of any region, please have a atlas, put an atlas on your side, so that whatever you learn or whatever you read from the book, confirm it by seeing on the atlas. You know that in daily life we perform many functions, and regarding the lower limb, we are using our lower limb every day in every respect. While we are sitting over our gluteal region. When we sit, when we stand, we use the muscles of the thigh. We use all our lower limb during walking, running, going upstairs, coming downstairs. And in this whole process, we are continuously flexing, extending our hip joint. We are flexing, we are extending our knees. We are using foot muscles. We are standing on our foot. We are transmitting our weight to the foot. The only thing is that we have to recall every time that what actually we are using, what we are doing. When we walk and when we flex or extend our knee, so if we recall in our mind which are the muscles which are extending my knee joint, then you will have a better understanding of anatomy. So whatever you read, until and unless you apply it, then it will be very difficult for us to understand. So we're keeping these things in mind. Now we will start with the anterior compartment of thigh. So before start, here is shown the anterior side of the thigh. We are seeing different color muscles which are labeled here with different colors, and we are seeing some of muscles are coming from the posterior abdominal wall, and other muscles they are in the front of the thigh. As in the upper limb, we have seen that different compartments have been made by the intermuscular septa, which are thrown inside through the deep fascia. These are the modification of deep fascia, which one end is attached to the bone, and it divides the limb the part of the limb in different compartments. So when we see the lower limb, here is a cross section about the mid thigh, and in this we see that there is a lateral intermuscular septum, there is a medial intermuscular septum, and it is dividing then the into three compartments basically, and there is here also a septum-like thing. We cannot say it's septum, but it's septum-like thing going inside, dividing the thigh into one, that is the anterior one, and a medial side, which is the adductor compartment, and posteriorly is the posterior compartment of the thigh. So we are going to discuss about the muscles, nerves, and vessels of the anterior compartment of the thigh. Here are shown the four compartments. One is the anterior one. Here are some flexors of the hip, some extensors of the knee, and their nerve supply. And there is a medial compartment which is called as adductor compartment of the hip. And this S nerve is obturator nerve, is a posterior compartment which will actually flex the knee or extend the hip joint, and these are called hamstring muscles, and their nerve is sciatic nerve. So there are three compartments in the thigh. We will discuss it separately. Here are the shows the muscles of the anterior compartment of the thigh. So another cross-sectional view showing three compartments. You can see here that the anterolateral, you can say anterolateral, anterior or anterolateral compartment, in which there is one muscle that's labeled S, means Sartorius, VM vastus medialis, VI vastus intermedius, VL vastus lateralis, RF rectus femoris. Similarly, on the medial side are the muscles of the adductor compartment, and three muscles, G gracilis, adductor longus, adductor prohibus, and adductor magnus. And here in the center lying the neurovascular bundle, having the deep femoral artery, vein, and some nerves. That saphenous nerve may be here. And the posterior side is a sciatic nerve. So this cross section is showing we are going to discuss this anterior compartment with this neurovascular bundle. So here you can put your hand over the front of your thigh, try to feel it from the anterior spiralic spine down to the patella, feel that thing. So here will be lying these muscles. By recalling in mind that if you put your hand, one of your hand over the hip joint, and recall that which muscles may be the flexors of the hip joint, so you will find that there is Sartorius, pectineus, psoas major, iliacus. These will flex the hip joint. And then there is the extensor. Put your hand over the front of thigh, extend your knee joint, and try to feel it. There is a group of muscles which you can feel, and one of them is rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. So what I want to say actually is that when you put your hand on the front of your thigh and then recall by closing your eyes, recall in your mind which muscles are holding you with your hand. So it's a rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. These four muscles are under your hand. These all muscles are supplied by femoral nerve. Now here is the cadaveric showing the muscles. Here the sartorius muscle has been cut down to show the deeper muscles because it is extending from anterior superior iliac spine to the medial side of the tibia, upper end of the tibia, tibial condyle, and this muscle is cut to show the deep, other muscles of the front of the thigh. That in the center is the vastus rectus femoris, then laterally vastus lateralis, medially vastus medialis. Obviously, the vastus intermedius can only be seen when we will lift this rectus femoris. Then we will be able to see the vastus intermedius. In this slide, we are seeing here some neurovascular bundle also showing below the inguinal ligament. And if we look at carefully, we see that there is an artery, there is a vein, and there is a nerve. So this is the medial side, this is the lateral side. So if we see here, most medially is the vein, lateral to the vein is the artery, and lateral to the artery is the nerve. So these all will be named as femoral. So femoral vein, femoral artery, femoral nerve. So these will be present here, and we will discuss it, how they are present, how they, what's their relations in the anterior compartment of the thigh. So the very first muscle, now we will discuss individual muscles. So very first muscle of the anterior compartment of the thigh is iliopsoas. Iliopsoas means one part is ilio and other is psoas. Here in the diagram we can see that here is the ilial part of the iliopsoas muscles, means having origin from the iliac fossa, right or left iliac fossa. The other part of the muscle, that is psoas, is coming from the posterior abdominal wall, from the vertebra. And we can count from here, that's T12, L1, L2, L3, L4, from the sides of the bodies of these 1, 2, 3, 4, 5 muscles. When it is coming down psoas muscle, it blends with the iliacus. So here then it is called as iliopsoas muscle. Iliopsoas muscle. And you can see here it is going down, crossing in front of the hip joint, anterior to hip joint, and inserted over the anterior at the lesser trochanter of the femur. So we can very well imagine that if this muscle contracts, this will cause what? This is a powerful flexor of the thigh, because you can see the bulk of the muscle. Now you can check this muscle while you are sitting on the chair or a bench. Just extend your knee, try to lift your leg straight upward, and here you are flexing actually your hip joint. And this action is done by iliopsoas muscle. Now while you are lifting your leg, when you are lying on the bed or sitting on the chair, straight upward, superiorly, so you can very well imagine which muscle will be doing this action, flexion of the hip joint, and that muscle will be iliopsoas. And when you know that it's iliopsoas, just recall in your mind its origin. Keep this picture in your mind and recall it in your mind, and you will see that if you once recall it 1 to 2 times, they will be permanently memorized by you. And regarding the nerve supply of this muscle, we are seeing here that the psoas major is by the rami of the L1 to L3, and iliacus is by the femoral nerve. We can see from here also. So this part of the muscle should be supplied by the anterior rami of L1, L2, L3, while this part of the muscle, that is iliacus, this should be supplied by femoral nerve. Now, another muscle which is a ribbon-like and very important and very liked by the students is the sartorius. Sartorius, a rope-like muscle. Here we can see it's arising from anterior superior iliac spine, going obliquely downward, and here is the medial side of the upper end of the tibia, medial condyle, just below the medial condyle of the tibia. Here it is inserted. So if you imagine this keeping this in mind, try to pull it. Then you will see that it will crossing anterior to the hip joint, so it will flex the hip joint, and it will try to move inside the leg, but there will be adduction also.
الانجوينال ليجامنت اهي، وده
So
الفيمورال
finally
تراينجل، دي
action
الادكتور لونجس
becomes
اتقطعت اهي عشان يبان تحتها الادكتور بريفيس،
it
وبعد
will
الادكتور بريفيس
flex,
في الادكتور ماجنس، ادي
adduct,
بكتينيوس ماسل، دي سوس ميجور، ودي
and
هنا
laterally
الياكس،
rotate the thigh
وادي
at hip
سارتوريوس،
joint.
وده التراينجل ده اسمه فيمورال تراينجل.
So
لما نيجي
this
نتكلم
here we
على
come to know about
البروفاند
the
ارتري، ده
Sartorius.
نقول
Nerve supply
the main
L2
source
and
of the
L3
blood supply
are
to the
part of
thigh. كويس.
femoral
الكورس
nerve.
بتاعه بيطلع من البوسترو لاترال اسبيكتس اوف ذا
Now
فيمورال ارتري، يعني ادي الفيمورال ارتري من البوسترو لاترال اسبيكت اوف ذا فيمورال ارتري 4 سنتيمتر بلو ذا انجوينال ليجامنت. اذا كانت دي الانجوينال ليجامنت فهو 4 سم بلو ذا انجوينال ليجامنت. الارتري ده بيعدي تحت الفيمورال ارتري، يبقى
now
هنا
the next muscle
curves
is the
medially
pectineus muscle.
behind the femoral
The pectineus
artery.
muscle
وبعدين بيعدي على ماسل اسمها
pectineus
ادي واحد،
muscle
وبعدين يعدي اندر كفر اوف الدكتور لونجس. ده يبقى البروفاند ارتري عدى على البكتينيوس، طلع من البوستر لاترال اسبكت 4 سم بلو ذا انجوينال ليجامنت، طلع هنا مشي على البكتينيوس، مشي اندر كفر اوف الدكتور.
Now some sound was abstracting me from the net, so I have closed it. Now I will come back to my this presentation. Now now here we are seeing a small muscles. Previously we have seen what muscle? Sartorius. And when you try to perform in this action while you are sitting at your room, sitting on the sofa or sitting on the bed, you can flex the abduct the limb and laterally rotate it, and you will find that you are sitting like a tailor is sitting in his shop while he is doing his work. So it's also called a tailor muscle. Try to perform this action while you are studying this muscle, you will understand more. And when doing the action, you recall in your mind its proximal attachment is distal attachment, and then you will fully understand the sartorius muscle. Why it is called, if you will perform its function, then you will understand that why this muscle is called as Taylor's muscle. The next muscle is the pectineus. Here we can see this muscle originating from the pectineal line, superior ramus of the pubic, and it's coming down over the medial side, upper end of the medial side, a pectineal line of the femur. It is attaching. So seeing this attachment, when it will contract, what it will do? It will obviously attack the femur, and also because it is a little bit anterior to the hip joint, so it will flex. So when we see it, it's arising from superior ramus of pubis and its pectineal line of femur. It will adduct and flex the thigh. But you are seeing that this is a very small muscle. So how much strength it can put while flexing or adducting the thigh? So it's a very small action, very minor muscle. It's not stronger muscle as the Iliopsoas we have seen before. So more powerful flexor are the iliopsoas, but pectineus is a flexor of thigh, but weaker flexor of thigh. And the nerve, this muscle is supplied by two nerves, that is femoral and obturator nerve. So because it is supplied by two nerves, so it can be called as a hybrid muscle because it is having two nerve supplies. If one nerve goes off somehow or damaged, then the other nerve will take over the function. So that's why these muscles are called hybrid muscles, having two nerve supplies. Just like that you have seen the cars which are hybrid one, if the petrol is finished, then the car can move on the battery. So it has two source of power supply in that. That's why they are called hybrid cars. Similarly, this muscle is also called as hybrid because it is having two nerves. Now, the very important group of muscles which are quadriceps femoris muscle. It's a group of muscle, not a single muscle. Quadri means four. Quadriceps means four. So there are four muscles which are combined together, and they are then named as quadriceps femoris because they are attached to the femur and they extend the knee joint. So that's why they are called as femoris. Just like that in the upper limb, we were naming the things according to the brachium, that is the brachial artery, profunda brachial artery, and the biceps brachial muscle. So here is the quadriceps muscle, means four muscles are combined together. And if you now place your hand over the front of your thigh, then you will understand more. The very first muscle, imagine it, and look at the atlas, this muscle, the very first muscle, which is rectus femoris. See its fibers. Here is a median raphe and fibers are coming from both sides. So it's a bipinnate muscle, you can see. Okay. And if we see its origin, here we can see the origin of the rectus femoris from the hip bone. One is here, that's if this is the anterior superior iliac spine, this will be anterior inferior iliac spine. So one head is coming from anterior inferior iliac spine, which will be straight head of the muscle, straight head. And this here is the second origin, which is a reflected oblique one. So this if this part is the part of the bone is ilium, so above the acetabulum, this will be ilium part of the bone. So above the acetabulum is the ilium, is the reflected head. And these all are inserted with other muscles to the patella. We will see in the further diagram how it is. Its nerve supply is a femoral nerve. So when we see it, its origin here, it's above the acetabulum. So the muscle is passing actually anterior to the hip joint. If it is anterior to the hip joint, so it will flex the hip joint, and because through its insertion over the patella, it will be extensor of the knee joint. So it can be very easily understood. So very first muscle is the rectus femoris, and the other muscles here we see that on the lateral side is a vastus muscle, vastus lateralis. On the medial side is a muscle, vastus medialis, and obviously beneath this will be the vastus intermedius. So when we see this, here is we will find where are the attachment of these muscles. So here we see the origin of vastus lateralis, and when we see from posteriorly, it is extending down to the intertrochanteric line and down. Here is the origin of vastus medialis on the medial side, inferior to the lesser trochanteric, and this can be traced over the posterior side, over the medial lip of, that is linea aspera, medial lip of linea aspera. Besides this, medial to that is the origin of adductor muscles. So here the vastus medialis origin, and medial to this low down will be origin of adductor muscles. We see this now from the anterior side of this is the vastus medius. Here we are seeing the origin of vastus intermedius. So from here we can very well see the origin of these muscles from the femur. So they are not crossing the hip joint, so they will have no action over the hip joint, but their major action will be over the knee joint. Okay, so this can be understood very well. Here is we are seeing origin of rectus femoris muscle. So rectus femoris, vastus medialis, vastus lateralis, here it is coming down, and vastus intermedius, they are combining together below, and how they are inserted we will see it. So vastus lateralis from the greater truncated and lateral lip of the linea, as per we have seen it, and the vastus intermedius, anterior and lateral surface of the femoral shaft, we have seen it, and the vastus medialis, intertrochanteric line and medial lip of linea, as per we have seen it. So we have seen their origin in the previous slide. Here we have seen the origins of, we can confirm it, and now, and if you are so much confused, you can label that they are originating from the femur, not from the hip bone. The only muscle which is originating from the hip bone is rectus femoris. Other muscles, they are originating from the femur, shaft of the femur. And then you can, if you hold the femur and if you have the atlas with you open, then you can see, confirm their attachment over the femur. And once you are confirmed, just recall in your mind about the picture, what you have seen on the atlas or some other book, then it will be easily understood and memorized by you. So here is the quadriceps muscle, again very shortly shown. That is the rectus femoris, origin, insertion and action. Vastus lateralis medialis, origin from the femur, insertion of the patella and sartorius. Now here we will discuss the insertion of vastus quadriceps femoris muscle. So if we see here in this slide, here should be lying the patella. Put your hand over the patella. If you put your hand over the patella, just try to hold the patella with your thumb placed superiorly over the patella and your fingers, 3 fingers, index finger, middle and ring finger below the patella. Hold the patella like this. Now your thumb is over the tendon which is formed by the fusion of these 4 muscles. If these 4 muscles are combined together and they are forming a tendon, so your thumb is lying over the quadriceps tendon, which is attached to the superior border of patella. Superior border of patella. Patella is a sesamoid bone. You will learn later on when you will read osteology, and if you have read already, the osteology is a sesamoid bone. So in between the tendon of quadriceps. So your thumb is lying on the quadriceps tendon, and if you have felt it here, it is the quadriceps tendon which is attached to the upper part of the patella. You can confirm it on your book of also, if you have the book with you and you have opened it and you are seeing the knee joint, you can confirm it also. From the patella, where your index, middle and ring finger are lying below the patella, it is going up to the tibial tuberosity, and from the patella to the tibial tuberosity, it will not be called as quadriceps tendon, it will become the patellar ligament or patellar tendon, patellar ligament. So it's very necessary to differentiate both these. Above your thumb is on the quadriceps tendon, but below your fingers are on the patellar ligament, which is attached to the tibial tuberosity. So we see that through the patella, it is crossing the knee joint and attached to the tibial tuberosity. So we can very well imagine when it will contract, it will be a very, very strong. If you have your hand over the front of thigh, so you can, that the group of muscles is very heavy one. It is a heavy extensor of the knee joint. So now you can imagine, you can also imagine while you are playing football and you are trying to hit the football, and first you flex the knee, but when you extend the knee forcefully and try to hit the football with your foot, it's how much stronger is the extensor of the knee. You can very well imagine this, and this can be confirmed very easily. So if you see that, so here is the quadriceps muscles. One thing which is to be mentioned here is that although the only function of the vastus medialis and lateralis is shown here is the extensor and stabilization of the patella, but when you will read the big book, you will find that it's not given here, that this vastus lateralis is helping in stabilizing also the knee joint through its attachment to the away from the patella to the knee joint. And its vastus medialis is fiber, they are extending and they are also attached below to the tibia separately. And it is when we will study the locking and unlocking of the knee joint, we will there discuss how they help in the locking and unlocking of the knee joint. So that's an additional point that should be kept in mind. But the main here concern is that the quadriceps muscles, four muscles which are combined together below, and they form the quadricep tendon, which is inserted into the upper end of the patella. Below the patella is the patellar ligament, which is moving downward and attached to the tibial tuberosity. In this way, it's a strong extensor of the knee joint. The nerve is the femoral nerve to all these, femoral nerve L2, L3, L4. So the femoral nerve branch, which will go to each individual muscle, that will be named accordingly. Nerve to vastus medialis, nerve to vastus lateralis, nerve to vastus intermedius. But as combined, it's a femoral nerve which is supplying all the muscles in different levels. Okay, here it's not so much clear, the slide is not so much clear, but this table form is given in your books also. If you open the books, that is the main book, Keith Elmore, and you see that if you see it, you open that book, you will find this table. And this table is important not to understand, but it is very helpful if you understood all these things. You just categorize their, make a table, their proximal attachment, distal attachment, innervation, and action. So in the examination, you have to reproduce this. If some question comes, name the flexors of the hip joint or the extensor of the knee joint, so you have to reproduce on the paper. In this way, this will be easier for the examiner to study. This will be easier for the examiner to give you the marks. So this should be tried by you. But before that, you should have a full understanding of this, what we have discussed before. And here we have find by seeing, by doing the practice, the reason why these muscles are called and how they do their action, how they flex the hip joint, how they extend the knee joint, and we can very well. Now, if we have understood it very well, so we can ourselves reproduce this table without trying to ritualize it or trying to memorize this table, trying to figure out this table. We can ourselves reproduce this table on the paper if we have the full-fledged knowledge and full-fledged understanding of this. So extensor of the knee joint and flexor of the hip joint. So the next thing we will discuss in the next lecture will be the neurovascular of the anterior compartment of the thigh. And again, if I go back and starts from the beginning, so what we have seen from here, say, so there are the different compartments of the thigh, anterior, medial, and posterior one. There are the muscles. There are some muscles which will flex the hip joint. There are other muscles which will extend the knee joint. So if you can very well understand it and memorize it or recall it in your mind. So here is the cadaveric picture showing it. Here is the individual muscle iliopsoas, and then is the sartorius, then is the pectineus, then is the rectus femoris, part of quadriceps femoris muscle. Then there are three vasti muscles: vastus lateralis, vastus medialis, vastus intermedius. And in this slide you are seeing the direction of fibers from the center, so it's a bipinnate muscle. Now, and then is the whole the three muscles of the anterior compartment of the thigh, quadriceps, the nerve supply and action of the quadriceps, and the tables. Now, next lecture we will discuss the neurovascular of the anterior compartment of the thigh.